One moment, everything feels normal. You're walking, resting, breathing slowly. Then suddenly, you feel something warm. Your heart races, your thoughts scatter. Is this urine? Is it discharge? Or did my water just break? And then fear quietly enters your mind. Is my baby coming now? Am I ready? Is this dangerous? Today on MedLife Link, we will calmly information explained in simple language. This content is educational only and does not replace professional medical advice. Inside the mother's womb, the baby lives in a protected environment. The baby is surrounded by amniotic fluid, which is held inside a strong but flexible bag called the amniotic sac. Medical research shows that this fluid protects the baby from physical injury, supports bone and muscle development, maintains body temperature, and allows safe movement. When this sac naturally opens or tears, the fluid begins to leak out. This is commonly called water breaking. Medically, it is known as rupture of membranes. Water breaking does not feel the same for every woman. Some women experience a sudden gush of fluid. Others notice a slow, continuous leak. Medical studies explain that amniotic fluid cannot be controlled like urine. It usually continues to leak and is often clear or slightly milky. This is why many women feel confused at first, and that confusion is completely normal. In most healthy pregnancies, the water breaks during active labor close to delivery. However, sometimes it breaks before contractions even begin. This is called pre-labor rupture of membranes, or PROM. If this happens before 37 weeks of pregnancy, it is known as preterm PROM, which medical research considers higher risk and requires immediate hospital evaluation. One of the biggest myths is that once the water breaks, the baby is born immediately. Medical research shows this is not always true. Labor may begin within hours, or it may take longer. During this time, doctors monitor closely because once the water breaks, the risk of infection gradually increases. One of the biggest myths is that once the water breaks, the baby is born immediately. When your water breaks, the most important thing is to stay calm. Note the time, observe the color of the fluid, use a clean sanitary pad.
Always ask about the color of the fluid because it provides important medical clues. Clear or pale fluid is usually normal. Green or brown fluid may indicate the baby passed stool. Yellow or foul-smelling fluid may suggest infection. Bloody fluid requires urgent medical attention. Once the water breaks, the baby loses part of its natural protection. Medical guidelines recommend close monitoring or safe induction of labor, depending on gestational age and the condition of mother and baby. These decisions aim to reduce infection risk and ensure a safe birth.
For students, a brief summary. Rupture of membranes at term is normal. PROM is rupture before labor.